Hi everyone, I'm glad you're here. Thank you very much for joining me today. I'm Mary with Mary Greeley News. Is our medical system in danger? I don't know. What do you think? Myself, I do not have any supplements to my medical insurance. I just have Medicare. I have heard how some supplemental insurances are not covering a lot of different medications that used to be covered, and that the costs are going up. I was recently very surprised to hear about how there are many hospitals that are dropping Medicare Advantage plans. Medicare Advantage provides health coverage for more than half of the nation's seniors. But a growing number of hospitals and healthcare systems nationwide are dropping some of or all of the contracts with the private plans altogether. One of the most cited reasons are excessive prior authorization denial rates and slow payments from the insurers. Some have said that Medicare Advantage have faced allegations of billing fraud from the federal government and are being probed by lawmakers over their high denial rates. And that is true. In late September, Scripps Health began notifying patients it was terminating Medicare Advantage contracts for its integrated medical groups. Just for that one hospital, it's going to affect over 30,000 seniors in the region. Again, that's in San Diego. San Diego-based Scripps Health said that they are facing a loss of over $75 million just this year on MA contracts, which will end on December 31st for patients covered by United Healthcare, Anthem Blue Cross, Blue Shield of California, Centene's Health Net, and a few more similar carriers. In Bend, Oregon, the St. Charles Health System is not only dropping all Medicare Advantage plans, but is also encouraging its older patients not to enroll in the private plans during the upcoming enrollment period in October. So that's 11 months from now. 13 more recent insurances that hospitals have dropped Medicare Advantage. One is Nebraska Hospital Association. 33 of the hospitals there in Nebraska do not accept MA patients. York, Pennsylvania, WellSpan Health will no longer accept Humana Medical Advantage and United Healthcare, AARP, Medicare Advantage plans starting January 1st. United Healthcare Group, MA, PPO, and Humana Employer, PPO, and MA plans will still be accepted. Greenville, North Carolina. ECU Health said it anticipates it will no longer be in the network with Humana's Medicare Advantage plans starting January 1st. Raleigh, North Carolina. WakeMed went out of the network with Humana Medicare Advantage plans in October. The plan provides coverage for about 175,000 retired state employees. WakeMed cited a claim that the denial rate was 3 to 4 times higher with Humana compared with other contracted MA plans. Zanesville, Ohio, Genesis Healthcare System is dropping Anthem, BCBS, and Humana Medicare Advantage plans in 2024. Brunswick, Georgia, Southeast Georgia Health System will terminate its contract with Centene's Well Care Medical Advantage plan on December 8th. Nashville, Tennessee, Vanderbilt Health went out of the network with Humana's HMO Medicare Advantage plan in April. Fayetteville, North Carolina-based Cape Fear Valley Health. They dropped the United Healthcare Medicare Advantage plan in July. Corvallis, Oregon, Samaritan Health Services. They ended their commercial with Medicare Advantage contracts with United Healthcare. The 5-hospital nonprofit healthcare system cited slow processing of requests and claims. I believe that Samaritan hospitals will be dropping their plans on January 9th. Samaritan Physicians and Provider Services will be out of the network on November 1st, 2024. Cameron, Missouri Regional Medical Center stopped accepting Cigna's MA plans in 2023 and plans to drop Aetna and Humana in 2024. Now, it does plan to continue Medicare Advantage contracts with United Healthcare and BCBS, the St. Joseph News Press reported. Stillwater, Oklahoma Medical Center has ended all network contracts with Medicare Advantage plans amid financial challenges at the 114-bed hospital. Brookings, South Dakota Health System will no longer be in the network with nearly all Medicare Advantage plans in 2024. With the exception of Medica, the 49-bed municipally owned hospital said that the decision was made to protect the financial stability of the organization. And the last one I have is in Louisville, Kentucky. Baptist Health Medical Group went out of the network with Humana's Medicare Advantage plan in September. They will also drop out of the network with United Healthcare and Centene's Well Care on January 1st without a new agreement in place. Yeah, I don't know if this has got to do with the economy, what I'm going to tell you now, or what, but there's evidently 72 hospitals going to be closing departments or ending services. In Palmdale, California, Southwest Healthcare Regional Medical Center laid off 87 employees following the October 30th closure of its maternity ward. In Toledo, Ohio, ProMedica is closing its urgent care center in Holland, Ohio, and merging with two others in Perrysburg, Ohio, effective January 1st. They also closed 2 healthcare locations and significantly scaled back operations at a third on November 1st. It is part of ProMedica's plan to exit the home health care business. In Denver, Texas, Wise Health System is relocating some of its oncology services and closing its radiation therapy services on December 1st. This is really going to affect people going through cancer treatment. In Coldwater, Michigan, ProMedica plans to discontinue its maternity services at the end of this year. Houston-based Texas Children's Hospital is shuttering 2 healthcare centers that mostly serves low-income patients. Also in Houston, Texas, the Centers for Women and Children will close its Greens Point, Texas location on December 1st and its Southwest Houston location on June 30th. In Cloquet, Minnesota, the Community Memorial Hospital is laying off 30 staff members because it's closing its nursing home it operates on its campus. They are also closing the Sunnyside Healthcare Center, they say because of nationwide financial problems facing facilities across the country. Wichita, Kansas, Ascension Visa Christi. On December 30th, they're going to cease operations at its emergency department in Fort Scott, Kansas. In Eugene, Oregon, the emergency department at Peace Health Sacred Heart Medical Center University, the hospital campus, will cease operations on December 1st. Albany, New York, St. Peter's Health Partners. Now, they have delayed the shutdown there for the maternity ward by 6 months because of communities' concerns about access and transportation. They now plan to close the maternity ward no later than June 30th. With all these closures, people are going to have to drive a lot farther. It's going to be a hardship on low-income people taking time out from work, things like that for families. In Ridgeview, Minnesota, the Mayo Clinic will be permanently closed on December 12th. In Monroeville, Alabama, Monroe County Hospital will shutter its obstetrics due to the lack of staff. Now that deals with problems that may occur in surgery during childbirth. Birmingham, Alabama. Brookwood Baptist Health is closing its obstetrics department at the hospital in Birmingham and Shelby County. 6 clinics run by the shuttered Williamston, North Carolina-based Martin General Hospital. 6 clinics closed on October 5th. In Nashville, Tennessee, which treats people with mental health, HCA Healthcare, they closed on October 4th. West Reading, Pennsylvania, they closed 5 urgent care centers on September 30th and sold 8 others to Birmingham, Alabama-based American Family Care. Dunn, North Carolina, the Betsy Johnson Hospital, part of a 2-hospital system, Harnett Health, ended labor and delivery services on October 15th. Van Wert, Ohio, they ended their inpatient maternity care on September 30th. Hartford City, Indiana, IU Health Blackford Hospital, they ended inpatient and emergency services on October 1st. In Detroit, Michigan, the Sinai Grace Hospital closed its outpatient cancer clinic on October 1st. York, Maine Hospital said it was closing its birthing center. It closed at the end of September because of declining births and shortage of workers. Inglewood, California, Centennial Hospital Medical Center ended its maternal child health services on October 25th. Glendale Heights, Illinois, they said because of the rising age of people in their community. UC Chicago Medicine Advert Health Glen Oaks, their obstetrics services would be discontinued. That would be related to childbirth. Tell City, Indiana, Perry County Memorial Hospital will end its labor and delivery services as of January 1st. We know that people are having less and less children. When you figure the cost of education and raising a child nowadays, it's not surprising people are putting off having children. Northfield, Minnesota, their hospital will close its 40-bed long-term care in October due to staffing and financial challenges. Lake Placid, New York, they're closing their emergency department there. In Syracuse, New York, St. Joseph Health, they shut down on October 23rd. Oceanside, California, the Tri-City Medical Center, they're evidently going to suspend labor and delivery services indefinitely. Charlotte, North Carolina, Star Med Healthcare announced it was closing 2 satellite locations on July 19th, and it said that they laid off 15 employees or 10% of their workforce. It said the centers would shift to primary and urgent care. Vicksburg, Mississippi, Merit Health River Region was shutting down its mental health unit, or they did shut it down on June 30th. In Wilkes-Barre, Pennsylvania, they abruptly shut down their childbirthing service there at the General Hospital on July 11th. Los Gatos, California, Mission Oaks Hospital closed its inpatient psychiatric facility at the Mission Oaks Hospital on August 20th. Less and less mental health across the nation. They're all being, or a majority of them are being shut down. Jackson, Mississippi, at St. Dominica Health Service, they also closed for mental health on June 6th. Fort Wayne, Indiana, the Lutheran Hospital closed its heart transplant and inpatient burn units. For here, Mammoth Falls, Wisconsin, they shut down their mental health facility too back on May 12th. Fort Kent, Maine, they closed their baby unit there, citing low birth rates and trouble with finding people to work. Einstein Medical Center, Elkins Park, Pennsylvania. They shut down their general surgery and emergency services. They're evidently converting the facility solely to physical rehabilitation. Cox, Missouri, Manette Hospital. They're closing down their labor and delivery services there, citing difficulties recruiting obstetricians and family practice physicians. Now here where I live, they've been recruiting a lot of new doctors from overseas, such as India. Warsaw, New York, they're shutting down its birthing center there. They closed down June 1st amid financial challenges and declining birth rates. That was what was called the Wyoming County Community Health Care System. Chelsea, Michigan, their hospital there closed its inpatient mental health service unit and moved 12 of its beds to Trinity Health in Ann Arbor, Michigan. Rhinebeck, New York, the Thomason House, a 100-bed rehabilitation facility there, laid off 102 employees, and that became effective April 12th. They're in Mason City, Iowa, for hospice care. They shut down on April 17th, Mercy One, North Iowa. They cited the closure was because of inflation and high labor costs. The Palmar Medical Center in Poway, California. They closed their labor and delivery unit at least until June. I believe that's next year. You know, there's a lot of people that get home health care. A lot of low-income people depend on home health care services. The Caldwell Huntington, West Virginia hospital there is evidently shutting that service down. They say it's to better align the reduced costs and amid financial headwinds. Yeah, the coming financial crisis that's going to impact our country and is already impacting our country. Austria Topisch Washington Hospital. That is one of many rural hospitals closing labor and delivery due to cost, creating maternity deserts in areas that need the care the most. Yeah, it's going to be where only the wealthy can get the care that they need. In Willoughby, Ohio, they were moving their labor and delivery services to another hospital that was about 15 miles away. Yeah, more time you have to do for traveling. Muskegon, Michigan, Trinity Health said it was closing its 30-bed surgical floor due to staffing shortages. In LaGrange, Texas, St. Mark's Medical Center, it cut nearly half of its staff and various services as it looks to survive amid significant financial challenges. Services that were cut included inpatient surgery services, post-acute skilled rehabilitation center, orthopedic clinic, and speedy therapy and ambulatory care. In Ohio, Shelby Hospital stopped providing maternity services this last February. People now have to travel about 13 miles farther to Ohio Health Mansfield Hospital. In Oroville, California, the Golden Valley Home Health Care, they shut down. Rumfield, Maine, the hospital there, closed its maternity program. They closed on March 31st after 97 years in service. I did not know that Moody also gave a rating for hospitals and different healthcare systems. Dozens of hospitals and healthcare systems have faced credit rating downgrades this year as the industry continued to wrestle with a challenging operating environment. As of the end of August, more than 60 hospitals and healthcare systems have been downgraded by at least one of the three largest credit rating agencies, citing operation losses stemming from labor shortages and high costs, plus dwindling liquidity, higher debt and cash ratios, or the possible default on debt agreement were the reasons for the downgrades. The U.S. healthcare system is crashing, just like the U.S. credit rating by Moody's. On October 10th, they lowered the U.S. credit rating from stable to negative, citing large-scale deficits and a decline in debt affordability. Yeah, people are already maxed out. We can't get any more credit because of the amount of the debt, and that's the same for the United States. 60 healthcare systems. Now, this would be healthcare systems that have multiple clinics and multiple hospitals, things like that. 60 of them had their credit rating lowered by Moody's. Sanford Health here in South Dakota, we had our credit rating lowered. They were citing that it was because of the mergers that they were trying to do for another hospital system up there in Minnesota. These large hospital systems are gobbling up the small town, different little clinics and hospitals, and eventually closing them down, which is creating health care deserts throughout the country. The ones that stay open, they end up raising the cost of health care when you go see your physicians. We are in trouble. So what are your thoughts? Put your comments down below. Thank you very much for watching. Please like, share, and subscribe. And I'll talk to you later. God bless y'all. Bye.